So we'll go ahead and get started right on time. Hello, I'm Professor Heather Woodley, in case any of you don't know me. I think most of you do. But I am here with the Institute for Global Health, and I just wanted to welcome you all, and we have a lot of great talks today coming from your fellow students about their summer experiences. And just quickly, before they started, I wanted to just mention quickly what we're thinking about providing this year in terms of international experiences. We'll be offering our annual trip to Geneva. That's in May, and it involves 1 week where students attend the World Health Assembly and another week where they do site visits to various agencies. I think we're going to hear a little bit about that from Z today. But it's led this year by Professors Laura Ferguson and Sophia Gruskin. I've also led the group for many years, and Nivi's here as well, who's gone on the trip many times. So if you have any questions about that, feel free to ask and approach us. And also there'll be a program that's under development right now in Costa Rica. This is a replacement for the trip to Panama that's been offered for the last several years. They're refocusing a little bit and taking a trip to Costa Rica instead. And that will be likely led by Professor Melissa Withers, and will take place in mid to late July. And then there's also the Public Health Immersion program in Uganda, which will take place in August. It takes place between the end of summer school and the beginning of the new term. So in that little break that students have, we run the 2-week program to Uganda, which you'll also hear about today. We also, through the Institute for Global Health and our various faculty, have the opportunity to place many of you in individual placements or practicums in agencies around the world. Some things to think about if you're contemplating going alone is kind of your language priorities, your location, and your thematic priorities. And so when you come and approach a faculty member, or if you're at the Institute, you have some guidance for us to help us go. Oh yeah, and we should all say hi to Simone. Hi Simone, you're going to be up in front of everyone the whole time. Simone is joining us from Paris. There's also individual placements can last from a few weeks to long periods of time, up to 3, 4, 5 months, depending on your interest. And then also this year, we're excited that we have some additional funding available to support these types of trips and research and immersion experiences. So we have the Bremen Global Health Immersion Fellowship that is providing up to $5,000 to support international research immersion. And this is due on a rolling basis. You can submit this application at any time and get feedback, right? Sorry? Right. So if you don't want to wait and you want to get it, go ahead and apply. I know it sounds ironic and a little crazy, but people don't apply for these. We literally have to throw the money out the door at people to try to convince them to apply. So if you're thinking that you're not applying because you're not competitive or you are worried that it's a waste of your time, I want to encourage you to think differently and get in an application, because we have quite a bit of money this year that we have to get out the door, and so we want you to apply. Please apply if you're at all interested in going abroad. We want to give you this money. Okay, and we can come back to these. I just wanted to get them out there ahead of time so you have that in mind while you're hearing all these presentations today. Okay, so our featured presentations today will be from Simone St. Clair, who's going to be speaking about menstrual hygiene in rural Ugandan secondary schools. We're also going to have a presentation by Shen from his experience at the World Health Assembly and then interning in the tobacco unit at the World Health Organization in Geneva. We're going to have a presentation by Ashley and Diana about the public health immersion program in general in Uganda. So one thing to think about is the difference is Ashley and Diana went on the structured program. You can go and you can get credit for it. You can apply and you can pay tuition and get your course credit for it. You can go simply as an immersion student, so you don't get credit. You just pay for the experience and you get it without having to do the extra work and the papers of a course. Or you can do it like the way Simone did it, which was she worked in advance of the program. She developed a whole research protocol. She helped prepare a lot of materials, and then she went and she implemented it during the program and then did a follow-up report and presentation on that work. So she stretched out that 2 weeks into more of like a 6-month project and got practicum. Actually, she didn't use it for a practicum, but you can also do that. And then we're going to have Edith talk to us about her work in Panama, in the Panama Practicum, and then finally we're going to have Divya talk to us about her work in Mongolia. Okay, so I need to skip this.
And the screen thing too is in the top.
That's okay. That's fine the way it is. Okay. All right, Simone, the floor is yours.
I'm in big screen now.
Yep. You're in super large.
Okay. Hi, everyone. I don't know who all is there, but if I don't know you, I'm Simone St. Clair. I just graduated from the MPH program in August, and I was on the Global Health Leadership track. So I went with a big group of people to Uganda in August, which was an amazing experience, and I'm sure Diane and Ashley will fill you in a little bit about all that we did. But first, I guess I'll give you a little bit of background on my project. So the point of my project was to evaluate barriers to menstrual hygiene in secondary schools and kind of evaluate how they affect school absenteeism. So in the community where we were working in Oyam in the north of Uganda, 30% of girls drop out of secondary school due to an inability to manage their periods. And so what I decided to do was collect, it was kind of like a two-part thing. So part of it was collecting data on what kind of barriers these schools are facing, whether that be lack of access with having doors on the bathrooms, having latrines that are separate from the boys, so kind of all these different things that might affect their ability to manage their periods, or even having access to pads at school, something as simple as that, and kind of figure out their attitudes about menstruation and the way they're treated at school. And then the second part of it was to teach girls how to make reusable menstrual pads. So this involved working with a group of women at an NGO that we partnered with called Global Health Network Uganda, and using their templates and kind of making our own kits. And then at camp we taught these girls how to make pads. So it was really fun. We got to talk to in depth with around 50 girls, and then over 300 girls ended up getting pads. So it was a really special experience. That definitely was probably the highlight of my whole MPH program. But kind of, I think what will be more important would be to talk about how to get these kinds of opportunities. So I was at USC as an undergraduate student and reached out to Dr. Whitley. I had heard about her through other students in the Global Health program and kind of heard about the work that she was doing, and was interested in getting to know her better and getting involved in what she was doing. So as a senior in college, I started working with her and Larissa on the Mama and Mama project, and kind of developed relationships with them and with the Institute, and that really translated into my graduate work because I kind of already had established some sort of a relationship and was able to carry that out and continue working on the projects they were working on. So that was really special, and I always knew I wanted to be involved in the Uganda project at some point and be part of the reunited camp. So I kind of came to Dr. Whitley and told her my interest, that I was really wanting to work in sexual and reproductive health, and if she had any ideas of what I could do, and she had already heard about and was really well informed about the issue of menstrual hygiene in schools in Uganda especially. So she kind of introduced me to the idea, and then I was able to do a ton of background research on the population, on the work that has been done and the work that's currently being done, what has and what hasn't worked, and kind of decide what approach I was going to take to this project. That also involved communicating with our partners in Uganda about what they were doing and what they think would be plausible with the time frame that we had, and kind of the way that camp is structured. And so my next step was developing a really strong research protocol using all the literature review I had done. There wasn't a lot on Uganda, but there was a lot on East Africa, and I was kind of able to pull together ideas from different places. And I developed a protocol as a guideline, which was really important. Probably one of the most valuable things I did, because I'm sure I'll do it again throughout my career. But I was able to use Dr. Whitley's protocol that she had used on the tobacco project as kind of a framework, because I had never written my own research protocol, and kind of get an idea of, okay, what do I need to look for? What do I need to prepare for ahead of time? And kind of use that outline for myself, give myself a timeline, and then I was able to work from there and prepare the logistics of it. So that was getting the money to do the project, talking to people who were on the ground in Uganda about getting the supplies ahead of time, because we were there for such a short period of time. I wouldn't have been able to get there and buy the supplies, and kind of how we wanted to put the kits together, and what the best approach would be for that whole thing. So I think the biggest recommendation I would give to anyone who's interested in doing an independent research study is first finding faculty who you're really interested in working with, whether that be that they're doing work that you're interested in, or you really like them in one of your classes and want to get to know them better. I think that's probably the best way to start. Just befriending your faculty and creating good relationships with them, having them as a resource for career advice or just general life advice. Like, it's just so important for getting through the program. And then just to be patient and open-minded when working on your own project, especially when you're working with people in other countries. You know, there's time differences and different work ethics, and so you just kind of have to be like ready to take whatever comes at you, and definitely give yourself plenty of time to prepare, because things will never come together as quickly as you anticipate. So giving yourself ample time for errors, and I think also just asking a lot of questions and running ideas by people really helps. I mean, especially people who are in country or people who have done work in the area that you're going to be working in. I mean, I had never been to Uganda, let alone Africa, before my trip, so it was super important for me to kind of get an idea of, okay, what can I kind of expect? Like, what's the population going to be like? How are they going to receive the project? So I could really make sure it was tailored to their cultural norms and their social norms. And yeah, so those are kind of my tips in finding an independent project. I don't know if anyone has any specific questions.
Any questions for Simone? What time is it, Simone?
Yeah, I just want to know that.
Midnight.
Midnight.
I'm sorry, my voice is kind of like hoarse. It's almost midnight. Yeah.
All right. Okay, there's some questions. All right, in the back?
You said, do I just speak
Sure, yeah, I think she can hear you. Sounds like.
You said that you partnered with faculty whose projects you're interested in. Like, could you tell us more about how you found those faculty members, or how you kind of like navigated searching people who were doing things that you were interested in doing?
Okay, I missed the last half of the question. I heard, like, how did I get in touch with faculty and kind of advocate for my project, but I missed the second half.
That's basically the main point of the question.
How did you find faculty? Yeah, how did you find what faculty were doing so that you could figure out which one you liked?
Well,
I just liked isn't really the right word, but.
No, that's right.
One of the best resources, I think, would just be the website for the Institute for Global Health. There's just little bios, and you can kind of read up on the projects that professors have done. I heard about Dr. Whitley through one of her students / great friends, Alex, and he was a classmate and friend of mine, and he told me about her, and he was like, you would love her, and you guys would get along, and like, you should work with her, blah, blah, blah. So that's how I got connected with her. It was kind of unusual, but mostly just for me, the professors that I've ended up getting connected with were professors I had myself in class. I just take classes that you're really interested in, and you'll find the right people. Like even just in terms of your classmates, like I've always found the classes that I've been most interested in, the people in my classes are people that I really get along with and who are like-minded and have similar visions. So you'll definitely find people who are kind of on the same track as you if you go that way. But yeah, I mean, I emailed Dr. Whitley. I didn't know her before. I just emailed her and said, I like what you're doing. Can I come and meet with you? And Dr. Whitley just happens to be really receptive to students and like wants to help students. But I think you'll probably get a similar reception from any professor. Just reach out and ask them. Hopefully they'll take you on.
Yeah.
I'm sorry if you mentioned this already, but what have you been up to since graduation, and where are you now?
Okay, what have I done since graduation? Okay, well, I just graduated. I'm doing something entirely unrelated to what I studied. I'm living in Paris, and I'm teaching part-time, and hopefully going to find an internship here. I'm working on that, in global health. I didn't apply to any jobs in global health until I graduated. I was a little bit overwhelmed, to be honest, because I did the program like really condensed and took a bunch of classes at once and finished it in a year. So I also really wanted to come to Paris and live here. So I'm kind of, I guess, taking a year to figure things out and find the right job for me and hopefully get more work experience as an intern and just have fun for a year. So that's what I'm doing.
Any other questions for Shen?
Were there any barriers or challenges that you had to overcome in implementing your research project?
Sorry, can someone repeat that for me?
It was barriers and challenges that you faced in implementing your research. Did you face any?
I surprisingly didn't feel like I did. I mean, I was worried that I would, and I really didn't.
She has a bad memory.
Yeah, Simone, what are you talking about?
No,
data?
No, well, a little bit. Remember when we had the translation issues? I think it was the demand.
No, I'm not talking the data like the tablets. That's different. I'm talking about my focus groups.
Oh.
Do you think they want?
No, I didn't. No, I
No,
didn't.
but-
Except for when
but-
the teachers were in on one.
Except, yeah. Okay, go on, sorry.
Tell them about the guys, Simone.
Yeah.
All the men coming up wanting them for their wives and.
Okay, well, let me first say about the focus groups. Aside from that, because I also did data collection, like general data collection, which was like, that was its own thing, that there were barriers to that, but that was just for planning. But with my focus groups, I felt like they went super well. In terms of like barriers that I was anticipating was more girls not wanting to be open and had trouble, like I just thought this subject was pretty sensitive and I didn't know if they would be comfortable talking about it. And I mean, they weren't super comfortable, but we were able to like get through to them, and we had like amazing translators there with the Global Health Network, and like, we just had amazing people that we were working with. So I only have positive memories, but I also, who knows, maybe I'm forgetting. But
So you're forgetting, for example, the human subjects.
What?
Oh,
therapy.
Yeah. Like,
But that isn't really my thing. That's why I'm not thinking about it. That wasn't that was my project. That was the RFC project. But I can talk about that too. Okay, so basically to clarify, for those of you who are very confused, we also I helped collect data for the general camp. So kind of to understand like health beliefs and attitudes about a variety of things, with like from infectious disease to like violence in the community. So we developed a survey, and we are hoping to get IRB approval for that. And like I said before about being open-minded when working with people in different time zones and with different work ethics, I mean, it just takes so much longer than you think. Like to get one document that you think would take 5 minutes to sign and send could take like a month. So we didn't end up getting IRB, unfortunately, because miscommunication or just like not getting documents in time from our partners, and probably are not planning, like are not getting started far enough in advance. So that was a bummer. And then when there are so many different things that we probably should have done in terms of collecting the data on the tablets. Like we probably should have had the survey translated, for example, into the local language, or like have legitimate translators there instead of like recruiting teachers to kind of help us translate, just because it skews the way people respond. But those were little things that I guess, were a bummer because we can't publish any sort of like peer-reviewed paper, but next time we will, hopefully.
Perfect. All right. Any other questions? All right. Thanks, Simone. Okay. Oh, I think we can just make you small if you'd like to stay.
Do you want to stay on?
She wants to go to bed.
You want to go to bed?
You probably want to go to bed.
To watch the live stream later.
Okay. Miss you.
Hi, Simone.
Bye.
Okay, so is there any undergrads here? There's some undergrads, okay. I wanted to share, so the Institute is offering a Problems Without Passports program this year for undergrads. We're going from top to bottom. It'll involve a week here at USC, a week at the World Health Assembly and visiting institutions in Geneva, and a week on the ground in Uganda. It's a 3-week program. So that's available to undergrads through the Problems Without Passports this year. So, okay. Yeah. The title they just gave it really sucks, so I'm trying to change it. But I think it's Rural Healthcare Delivery in Uganda, which doesn't really make sense because it's like from top to bottom. So that was an old title. But
Will we be putting it up on the website?
yes,
Okay.
the official meeting to like launch is Friday with the faculty, and then after that I'll publicize it.
Subscribe to our newsletter and I'll send out the info once it's done.
Hey everyone, so I'm Shen and I'm second year MPhil student with an emphasis on global health. So my interest in taking that trip as well as fulfilling my Practicum requirement at the World Health Assembly stems from the fact that I always aspire to eventually work at one of the regional or country offices of WHO, and having that internship experience really would help me get my foot in the door. So I expressed my interest in tobacco control to my academic advisor, Dr. Wifley, early during the first year, and she was able to reach out to her contacts and found me a internship position in the non-communicable disease department. There are also other faculty members who helped me tremendously in that process. I had multiple workshop sessions with Paula, who helped me polish and improve my resume. I also took advantage of those volunteer and internship opportunities that Rose Park sends out on a regular basis, and I think they are very good resume boosters. The course led by Dr. Grosking and Dr. Ferguson was spread out into 2 weeks. So during the first week, we visited a list of UN agencies, such as the World Health Assembly, United Nations High Commissioner for Refugees, the World Trade Organization, Gavi, the Vaccine Alliance, the World Economic Forum, the Global Fund to Fight AIDS, tuberculosis, and malaria, and UNAIDS. They are all very crucial stakeholders in the realm of global health. And during those visits, we were constantly exposed to the inner workings of those organizations by meeting with representatives from all those agencies and by engaging in discussions on a wide spectrum of public health topics. All those speakers, they provide great insights into how health is administered and organized on a global scale. So this is a picture of us after dinner at a Thai restaurant. after on a Sunday night. And second week, this is a picture I took while I was in the World Health Assembly. So the second week, the schedule and activities of the second week centered on the World Health Assembly. So by definition, World Health Assembly is a formal gathering of delegates from 194 WHO member states to determine new WHO policies and review and approve the program budget for WHO. It was fascinating to be there and to hear from all the delegates from all those member states speak on behalf of the nations about the headways they have made thus far in improving health, and also their goals and commitments for the years to come. On top of that, we also had the freedom to attend many side events on topics, on a variety of topics, which a lot of the side events were hosted in at the Intercontinental Hotel, as well as a lot of very upscale restaurants in close proximity to the Palais des Nations. Some of the challenges I faced during that course include like striking up conversations with all those high-level authorities, such as those ministers of health, at the Serpentine Cafe, which is the cafeteria at the Palais des Nations. So some strategies I came up with to overcome those challenges are just be as respectful as possible, be a very good listener, and practice my elevator pitch many times. So this is me taking notes during the World Health Assembly, and this picture is from the election of the new Director General, Dr. Tedros. And now, so my internship revolved around like doing a feasibility study on Immersion in China. Immersion is a text messaging based censorship program. So the things that I did was to research on like smoking prevalence and background information on tobacco control, on smoking and tobacco control, past tobacco control efforts in China, and also mobile phone use and culture of texting regulations on unsolicited messages, technical requirements, financial requirements for implementation of Immersion in China, as well as promotional strategies. I think networking during my internship was one of the highlights. I think it's very important to keep in contact with of other people you have worked with. So that's something I did to as part of the networking was, of course, you attend all the weekly staff meetings. You are not required to, but it's recommended that you attend all the staff department meetings. Also, like my supervisor, he was on mission trips many times, but even when he was not there, I report to him regularly about my work progress. Also actively networking with staff members and other interns. Lunchtime is a great opportunity to talk and chat with other interns on a variety of health topics. And also some other endeavors I made to nurture and establish good relationship with other interns include attending all the weekly GI events, which are events catered to all the interns, not only WHO interns, all the interns in Geneva. It's like a social event, weekly social event, basically. Also taking weekend trips to other Swiss cities and neighboring countries with other interns. And here are some pictures from Geneva I took when I was doing my internship there. And this is a picture of me with the former Director General, Dr. Margaret Chen, and the current Director General, Dr. Tedros. And this is one of our weekend trips. And guys have any questions?
Any questions on Geneva? Either to Z or me? Yep.
How early did you start applying for an internship with the W?
So I don't think you don't apply through the normal application, the normal portal, because the chance of you getting accepted is very slim. So what I did is to reach out to Dr. Whiffley as early as possible and express my interest. Like you have to have a very specific interest in one of the global health area. Like my interest was tobacco control, so I was very firm about it. And
how was the workload for the class?
For the class, the workload is not very. The 2 weeks were kind of intense because we had to wake up very early in the morning, like before 7 o'clock, because we have to meet at 8 o'clock, and then we attended a lot of setting events, also as well as World Health Assembly. But at the same time, we need to take a lot of notes, and also we had like weekly reflective journals. At the end of the course, we are required to submit a kind of analysis report, like a final paper on what we did for the past 2 weeks. The workload is okay, but it's kind of like pretty intense for the 2 weeks.
I always say for Geneva, you need to have really comfortable shoes.
Yeah, for sure.
You're
yes.
up on your feet walking and going for long, long hours.
I recommend you having like a backup pair of shoes just in case.
Thank you,
guys.
I think that Z was right about the identifying networking is one of the most important things you can do at WHO. I started my career at WHO, and that network has kind of extended throughout my entire career. But I always tell the story that on the very first day I started with another intern, and it's been, oh gosh, 20 years. That was 20 years ago. I'm really old. Okay, so that was 20 years ago, and 20 years later, we are still really close friends, and he's a faculty member in Canada, and we have a joint grant together. And so the people you meet, it's not only the leaders, but the interns you meet are going to be there as your colleagues throughout your entire career. Global health community is not very big, so the people you meet, they stick with you. Okay, Diana and Ashley.
I'm looking at the time, so we are going to kind of go through this a little bit quickly because I want to be mindful. I know we do have 2 presenters after us, so forgive us if we can speed through this a little bit. Just to introduce ourselves, my name is Diana. I'm an MPH candidate here. This is my 2nd year, so I'll be graduating in May.
And I'm Ashley, Master's Public Health and Global Health.
So kind of what Dr. Whiffley said, we're just going to be speaking a little bit briefly about the entire program in general, while Simone's is a little bit more specific.
So here are the trip logistics, which Dr. Whiffley and Simone kind of covered. So we were there for 2.5 weeks, and we went to Northern Oyam. We were teaching public health lessons to primary and secondary school students. We were partnered with Makerere students, which was definitely one of the highlights of the trip. So local public health Ugandan university students to help us. We also helped design the class curriculum and worksheet materials, as well as we were provided with cultural and tourist excursions we'll get into later, as well as visiting local health clinics and leaders. So you can see that's a group picture. Oh, aren't they? Oh. Well, they're just blown up, but that's our group, so we'll get into...
So a little bit of background about where we were in general. So like Ashley said, we're in Northern Oyam, Uganda, which I'm pretty sure, correct me if I'm wrong, Dr. Whiffley, that's one of the poorest districts in Oyam, if not the poorest. Just a little bit about the history. So does everyone remember Joseph Kony and hearing all about that stuff with the child soldiers? Okay, so this particular area that we were in, most of the people in this community actually lived through that. So they were experiencing a lot of child abductions, and they were really in the heart of what was going on there. So, and that was relatively recent. That was like 20, 30 years ago. So they were really rebuilding themselves. And they've had the same president since 1996, so he is still president as of today. And then the language that they spoke in 86, I'm sorry. I actually grabbed that from your departure thing. It was 86, not 96. Okay, sorry about that. So he's been there since 1986. Kampala is the main city of Uganda that we were in, and they primarily speak English in Uganda. And then in Oyam, they're speaking, is it Longo? And then some of the food that they eat is matoke, which is plantains, cassava, which is a root vegetable, sweet potatoes, meat stews and fish. And then their religion, they're primarily Christian, but they also do have followers of Islam and African traditional religions as well.
So what was great about this trip is we had a lot of local partnerships in order to really make it effective. So obviously USC, the Institute of Global Health, was of tremendous help. We also had Football for Good because, well, we don't have the main partner up here. So Football for Good was our soccer coaches, facilitators, as well as Yawi. Yawi was how we partnered with for the Makara University students. Global Health Network, you heard Simone mention, is the local Ugandan. We actually had one of the alumni, Evan Pai, who graduated 2 years ago now, works with them, and they were able to coordinate these partnerships with the school. But at the beginning of the slides, the main facilitator and partner was Ray United FC Football Club. So that is Dr. Whitflee's amazing teenage superhero son who has this really great nonprofit, and they were able to establish these partnerships with the schools to host a soccer camp. So that was a really great way to get the schools and the community to come out. And then we could integrate our public health lessons because we had a captive audience.
So a little bit about what you do before the camp. So you meet, I think, about a couple times before you leave. I think like 2 or 3 times is when we met. And essentially what you're doing is you're really working on designing your materials that you're going to be using for your public health sessions. So as Ashley mentioned, this is the soccer camp that we use to really meet the kids where they're at. But then in terms of what we're doing, we're conducting kind of public health workshops essentially and teaching them. So right here, these are the types of things that we talked about in our specific sessions. So there was infectious disease prevention, and the activity that we did was like a vector triangle essentially. And then avoiding risky behaviors, that was kind of like a little matching game thing had to do. And then nutrition, it was like kind of building your own plate, like the healthy balanced plate, tailored to the kind of food that they eat there, because obviously it's different than what we do here. The developing body and sexual reproductive health was one, and then they did Pictionary as one of their activities, and they also did kind of like a tic-tac-toe activity. Menstrual hygiene management, which Simone spoke on a little bit earlier. We did citizenship and stigma. I can't remember right now exactly the activity that was done for that. Ashley led the leadership and communication group, and then also we did pull-out surveys and focus groups, kind of what Simone mentioned on, but surveying the students on based on what was developed.
So during camp, we actually have Naz here too, who is at an integral part of the trip. So during the camp, it's a lot of fun. It's high intensity, so much dance. You've never danced more in your life. The kids are just so grateful and so happy to be there, to have visitors. You know, we were able to provide them through IGH and Ray United gifts as well to start off the day, as well as workbooks that have their lessons and worksheets and materials that you can help create. So our typical day, oh gosh, I don't even know what time did we wake up?
Well, Z's talking about waking up early. We're waking up early. Like some mornings we were waking up at 5, some we were waking up, I think like, we had to be out of there and leave at 7. So it was kind of like, everyone was different based on what time they got up, but we were up early, like every single day consistently. And then we wouldn't get home until
so you take a bus, you know, the dirt roads, the potholes, past the villages, and then you go to the schools, and everyone is so excited, and they flood the buses to come see you, and then you organize where your stations or your classrooms are going to be. The kids are served breakfast because they're all given breakfast. They get an opening ceremony where they receive their gifts. Then we go into our lessons, while half of the secondary school is learning soccer and doing the soccer drills. The rest of them are with us in the classrooms or in the teaching sites. And then we then swap after lunch is also provided to them as well. And we also had do we go into the? They're also we partnered with the USC School of Pharmacy, sent students and faculty of theirs, and there was also a medical outreach day that was provided. So they did diabetes, blood pressure, HIV testing, hepatitis B testing as well in the last.
That was really popular. There was hundreds and hundreds of people showed up, and some of the people that I was able to talk to because I was doing registration, some people came from really, really, really like hours away just to come to get these free testing because it's not offered all the time.
And what was our final results? I can't remember, but we had over 10 HIV positive, and about 8 Hep B positives. And
I do remember that hypertension is a new big thing. So when we were talking about some of the things that we went over in the groups, I anticipate probably non-communicable diseases kind of being an issue maybe next year, and then hypertension specifically. So I do remember that there was someone that came to the medical outreach, and she had to be like taken to the nearest health center essentially because she was like borderline about to have, I think, like a heart attack. Like her blood pressure was through the roof. So, and then the pharmacy people were like, I'm surprised she was even standing. So, yeah.
And then the other portion of the camps was really the cultural and tourist excursion. So we were thankful to have the opportunity to do homestays, which were coordinated by Global Health Network. So we did at least one night of homestay, and we were able to stay in a more traditional hut with a family as well. The families are village health team leaders that work with the government, completely voluntary to provide health information to the communities. And we also got to do the safari, of course, in Murchison Falls, very large waterfalls, and we were able safely to go on a boda with permission.
Not with permission.
Not
with permission.
With local students, so it was okay.
I had to include that picture. Sorry.
And we did like group dinners and things like
it's
that.
illegal. It's in the sign. You will not go on bodas.
Yeah.
I didn't know she put that.
I blame Kennedy. I blame Kennedy. I'm sorry. I loved it. Anyway, I love this picture too of one of our colleagues, Emma. When we went to the rhino sanctuary, like we were literally this close to the rhinos. It was absolutely insane. And when we were there, the guy was like, "This is such a special treat." I think we saw like 9 rhinos in total, and he's like, typically people see like 2 or 3 when they come here. And we were really lucky enough to see this was actually a newborn baby, so we were really lucky to be able to see that. Another thing of what we did when we weren't at camp is Dr. Whitfley organized like appointments and meetings for us to visit local health centers and also different public health agencies in the area. So we went to the Ministry of Health, the Infectious Disease Institute, which was beautiful, and I believe that was on the university campus. And then here's a picture of Ashley right here at the Ugandan Cancer Center. And then the referral hospital, was that the one that we went to? We went to so many places. The one when they asked like if anyone had malaria, if we'd feel comfortable going there. Is that what it was?
No, that was the Health Center 4.
Health Center 4. Okay.
Yeah.
And then the Monterey School of Public Health, which was really cool. We got to sit down with one of the professors, and they gave us a lecture about kind of what they do, the public health issues that are really pertinent to where they are, and specifically in Uganda. And then one of the things that I thought was really one of the highlights is the health center districts that we got to go to. So in Uganda, the health centers range from 1 to 4. We didn't go to 1 because essentially Dr. Whitfley was saying it's like someone sitting under a tree.
It's the village health team.
The village health team, okay.
Yeah.
Just kidding. And then
Which
health
is
center 2.
someone sitting under a tree.
Yeah. And then health center 2 was very small, but they were open 24 hours, kind of like what you go to locally. And then Health Center 3 was the maternity ward that we went to, and that's this picture right here. A couple women when we went had actually just given birth. It's very eye-opening when you're actually when you are in these facilities and you're seeing like this is where people are getting their care at and how drastically it differs from like the U.S. And then we went to Health Center 4, which is much bigger. It's the equivalent of their like hospital essentially. And that is something that you only go to, right, for like emergencies. You're typically utilizing the lower health center levels.
And it was amazing too to see the partnerships like USAID and PEPFAR and just how much our funding is pivotal in these places. It was sadly a question a lot of people were asking us is if we knew if funding was going to continue, and obviously we don't. But so it was good to see just how much work the U.S. is also putting in. So we're talking about the importance of travel, especially for if you're on the global health track. It really gives you that first-hand experience of global health issues. As Simone mentioned, there are so many structural, on-the-ground issues that you really will not be able to think of, or it will translate from your thesis research or whatever you're doing unless you're on the ground. So it's really a unique opportunity for you to learn about other diverse cultures, peoples, communities, and enhance your critical thinking skills. You know, I think that we always said, Dr. Whitley always reminded us, flexibility is the most important thing you need in this trip. And so just thinking about like troubleshooting issues or things that are happening, you know, or if the kids aren't really understanding this lesson that you spent so much time working on, how can you make it relatable and easy for them to understand? Do you want to do that now?
Well, I'm looking at the timer. Let's just like, but yeah, basically, if this is what you want to do, if you want to have a career in global health, like, essentially, you need to commit the time and be on the ground and doing these experiences, because that's what people are going to be looking for when you're getting hired. And then lastly, just to kind of end, we have a brief video that I want to show you all because it's really cool. Ashley mentioned our alum, Evan, had put this together. Yeah, it's just a brief 3-minute video that I really think kind of captures the time together, and I think it's really cute.
Maybe full screen.
How did I do that? It's over here.
Wait, it was up in the back.
Move the browser over.
Yeah.
The bottom right.
There.
Yeah.
So that's Ray right there, and that's Dr. Whitley's son.
Carrie's here too. Yay, hi, Carrie.
So those are actually the reusable pads.
And then she was actually speaking to men there, which you were mentioning, that wanted to learn so they could take it home to their wives.
So then they are building their plate. Those are one of the focus groups that Simone was talking about when you kind of gathered the girls and got more depth. This is the infectious disease activity that knives and carry around.
That's a stigma line.
That's risky behaviors.
The soccer camp is underway. We've got 250
That's
kids.
the alumni, Evan, who lives and works there in OEM.
He works with, yeah.
He was also an undergrad at USC. He went all the way through. Football for Good is based on OEM.
Camp and started a little dance party.
So this is literally every day, like what you do to start and what you do to end.
And the kids who aren't wearing shirts, like they're not, most of those kids are not in the camp. They're just kids in the community who show up.
Today's the final day of the camp, and we've set up a medical outreach at Loro Secondary School.
So saying Football for Good, they have an academy in OEM, in Gulu, near there, that they try to recruit the best players from all of Uganda to try to get a professional player out of Uganda. They're doing intensive soccer training, and they recruited one kid from our camp to join their academy, which is also pretty interesting.
And this line where everyone was sitting, like it was just literally filled all the whole time. Yeah.
Yay.
further questions, you can go ahead and.
Where did you live and what kind of food did you eat?
So
and
we
what were the conditions?
Yeah, we were eating traditional Ugandan food almost all the time, except for at dinner you were kind of free to go out and eat like.
But we were at hotels.
Yeah.
Yeah.
Yeah, you had a bed to sleep in every night, which is really nice after you were tired.
We had
like low expectations.
fans, mosquito
No,
nets.
we at the second week we were staying in a really nice hotel, which was so nice. And you had warm showers.
Yeah, you're provided bottled water the entire trip.
Yeah, you have warm showers most of the
Mosquito
time.
nets,
And what about
beds.
the weather?
Huh?
How hot was it?
Oh, it was really nice. We got really lucky.
Yeah.
It wasn't too hot at all.
Like the same as here?
Later was cooler than here.
Yeah.
It's a pretty mild, in August especially, it's pretty, I mean, it's not so bad.
And it was like, I think they were kind of transferring to the rainy season, so it wasn't, we got really lucky with the weather.
What is the workload?
It's not as bad.
University requires? Oh.
Or like where we
I wouldn't be able to answer that question because Ashley and I didn't take it as a course. We just took it kind of outside of that.
I can.
But I'm sure, yeah.
The course. So we had only a couple people register for the course, so that's another kind of challenge. So some students really want these experiences and don't want to pay the whole tuition or don't have room in their compacted schedule to do it. So we do allow students to go on to Uganda without enrolling in the course, but we also offer it as a course. So those who go for the course, they have to do a few extra assignments and like a final paper write-up on a topic that they focused on during the trip. They kind of choose something. Kind of like, Simone actually didn't take it, but if she had, she could have written a report on menstrual hygiene. The one student who did, that was Emma, she wrote,
Ryan?
it was Emma. She wrote on like risky behaviors, and yeah, I think it was on risky behaviors amongst adolescents in Uganda. So we just add something on there.
So yeah.
You said that in the last day there was this medical camp which you had set up, so how much prior preparation did that take?
Actually,
Well, it was coordinated by the USC School of Pharmacy.
Right.
So they also work very closely with a local medical outreach team who does this more often. And so they coordinated with them in advance about what additional supplies and things they could bring from the U.S., although that can be a little tricky with importation. So they didn't take a lot of stuff. Instead, we were provided with a budget, which through Reunited we funded. And so they just kind of pre-prepped and then showed up and made sure everything was available and got it there on that day, and coordinated staff and things like that.
Does Edith want to come up? Is Edith here?
Yes, but can I change my slides?
Sure.
Sorry.
Plug in your computer. Is that easier?
Adding pictures because I was working on it last night. Okay. Okay, you don't have the audio? No. Okay, perfect. Oh,
All right, so we have 2 more presentations, so it's going to go a little long. If you guys need to leave, that's okay. But we're going to keep going them, so just put it, we have it all online.
And it should, there you go. Okay.
You can see they just have too much, students have too much to say. It's too much to compact.
So I made my presentation last night after working on SAS homework, so mine's not as great as the Ugandan one. So I went to Panama and I was there for not only the course, but I was there for my practicum. So my Panama trip was 6 weeks. It's shorter than the other trip, so it's 2 weeks course, 4 weeks practicum. So for your first thoughts on arrival, it's super humid. I tell everybody when I get there that you feel like you got a wet rag smacked across your face because it is so hot. I remember grabbing my luggage and we walked outside and I started sweating just waiting for our ride from the airport to the hotel. So our Panama group was it had 2 professors. Our first week was Dr. Steinberg, and our second week was Dr. Withers. We had 1 TA, which was Jen, and then there was a total of 9 students with a mixture of online and school, like on campus, and then it was different tracks and different backgrounds. So this was our group. Since the Panama trip it works with USF, we had a couple of students from USF occasionally join the USC group. And this was us at Emerald, which is one of the several tribes that still exist in Panama. So the 2 weeks are planned down to a T. The first week is more of understanding Panama and understanding its culture, and then the second week you really dive into your project. And so I'll talk about that in a minute. And so yeah, that's us at the clinic. So Centro de Salud, it's a primary care center in a red light district, and it serves 60,000 people in the community. It's currently short-staffed, and they don't have an OBGYN. It opens at 7, and there's already a line that's waiting for medical care. And some of their biggest problems are breast cancer, heart disease, HPV, and teen pregnancy. So projects at Las Mañanitas, we were split up into several groups, 3 groups to be exact, and we were assigned different health problems. We had to evaluate the clinic and create something tangible for the clinic to keep. So our group was assigned teen pregnancy because they have staggering statistics. 33% of teenagers from ages 10 to 19 will become pregnant. And so they wanted us to create some kind of brochure so that they can pass out to patients while they're waiting before they get seen by a doctor. What we did to create our brochure, we first created a survey, and we interviewed women. To see what were the discrepancies between the clinic and what the patients actually understood, or what they knew that was available, things like that. And in the end, we presented our findings to the staff, and we gave them our materials. So this is us working in the clinic, this is us working in the clinic, and then at the end we were asked to present our materials and to the clinic, to people waiting in the clinic. So the first 2 weeks, it's a lot of fun. You get to visit Emerald, which I mentioned earlier, and then they give you they serve you some of their traditional foods in plantain leaves. And so this is patacones, which is a smashed plantain, which is fried. They have a lot of fried food over there, and it's actually kind of hard to get fruits and vegetables into your daily in your daily meals. And then we also had the fish, which is corvina, which is basically a staple in Panama. And everywhere you go, you will be offered platacones and corvina, and usually with a side of rice. So yeah, it's really difficult to get fruits over there. And then this is visiting Panama Viejo, which is one of the first places that was colonized. There you go. Sorry, colonized in Panama. And then that's our tour guide. We became really close friends with her. We were really sad when we separated from her. Again, this is us working in the clinic. This was the day that they were presenting the issues to us. And then we also, in the first week, we got to visit some of their vaccine. So Panama has a really good vaccination program, unlike the United States. They actually vaccinate everyone. We were told several times that last year when they went to Panama, they had a flu outbreak, and so the government basically told everybody that it was mandatory to go get a vaccine. So there was lines and lines for people to get vaccinated. And they don't have the issue of anti-vaxxers like we do here, but they are starting to see little signs of anti-vaxxers. This was a trip that we went to a sex worker clinic. And this lady, her name is Dulceana, she was like the sweetest lady. She told us her story. She's actually a sex worker. And we were also able to ask her questions. Although, remind me again, it's not illegal, right?
Correct.
Prostitution is not illegal in Panama, and so they offer these clinics several days a week, to offer services because they do have to carry these cards that say that they are clean. One of the things that we found out was that if you are an immigrant from a different country, if you are a sex worker and you are found to have HIV and AIDS, if you're a female, you are actually sent back to your country, but if you are male, nothing happens to you, you can stay. What the heck? We took a trip with the vector control group, and they were showing us how they go around and test the waters nearby to make sure that vectors aren't, there aren't any breeding grounds, because since it rains a lot in Panama, they do have a lot of mosquito problems of like dengue, yellow fever. They haven't seen a lot of the Zika, but they did have some areas. One of the weekends that we were able to get out of the city of Panama, we went to El Valle, and that's where we went ziplining. You had the choice of going or staying at the hotel, and most of us decided to go. And so then you get one free day of doing whatever you want. And 3 of us decided to go. Panama is on the Pacific side of, Panama City is on the Pacific side of the ocean. And so we decided to go to the Caribbean side, and that was a lot of fun. The water was warm. So we went to San Blas. It was like $160. And you get transported over there, you get food, and you get you take boats to different islands that are or some of them are uninhabited, and then some are inhabited. Yeah. And that was a lot of fun. So my practicum, I did it with ANSEC, which is the Asociación Nacional contra el Cáncer. And so 2 students last year, they worked on their practicum there with Dr. Calvo and Dr. Espino, and they told me that they wanted me to pick up where they had left off. And so for my practicum, I was tasked with creating a database for the clinic to use so that they can transition from paper over to an electronic health record system. I worked at one clinic, but they were hoping to get it out to all the clinics in Panama. And aside from working on the database, I was also asked to give a couple of educational lectures on cervical cancer, because although they are vaccinating all children over the age of 12, when they turn 12, people who weren't vaccinated before 12, there's a high incidence rate of cervical cancer among them. And so for my practicum, when I was doing the database, I did run into a couple of issues, but I feel like that might be an issue when you go abroad, because you're not picking your practicum. It's kind of, well, I mean, that's how it was in Panama. Like I didn't pick my practicum over there. It was kind of assigned to me. But after speaking to Dr. Steinberg and Dr. Calvo, they were actually able to sort things out for me, and things went smoothly after that. And that's about it. Sorry. And so just money, like how much I spent. So on the trip, not including housing, I spent around $2,000 for 6 weeks, including hotel and Airbnb. I spent about $3,000 for the 6 weeks. To be honest, I went into Panama thinking, oh, it's the third world country, I'm not going to be spending a lot. No, they use the American dollar, and everything is a little bit, if not as expensive, a little bit more expensive in Panama because a lot of things are imported. Yeah.
Any questions? Right, thank you. Now, we haven't talked about money, but that is something also to think about. And also, the sooner you know where you want to go, the sooner you can buy tickets. And at least for Geneva and Uganda, the dates of the trips are already pretty much set, so you can buy very early if you want to go. I just was checking on Uganda tickets, and they're like $600 right now, which is really great. But Panama or the Central American flights are obviously a lot less than the European or Ugandan flights. And then after that, it kind of gets a little bit more equal.
Also, if you guys want to decide to go to Geneva, book your accommodation as early as possible, because I spent like $2,000 per month on Airbnb. More than a little bit over $2,000.
Housing in Uganda, in Geneva, is an issue. So
and
that
also everything is super expensive. It's like twice as much as they are in Los Angeles. It's super expensive, but it's worth it.
Okay, ready?
Sorry.
Do we know her? Yeah. Yeah, that's what I'm saying. I think it's you, right? You keep standing up. It's you, right? You're good. Keep pushing him. Sorry. I don't know you. Where does it click forward? The computer's gone. How does it up? How do we click now?
The keyboard is underneath.
Oh, there we go.
It's just a USB, yeah.
Oh, perfect. Okay.
Hi everyone, my name is Divya Patel and I'm a second year medical student here at Keck. I'm interested in pediatrics and global health, and this summer I had the privilege of working with Dr. Ponaraj from CHLA, who's part of the Department of Infectious Disease, to look at infant mortality in Mongolia. We specifically focused on group B strep, which is the leading cause of neonatal sepsis globally. And the reason we were in Mongolia is because CHLA has a long-standing relationship at Mongolia. So a little bit about Mongolia's background. It's located between China and Russia. It has a population of about 3 million, and half of the population lives in the capital city of Ulaanbaatar. It's traditionally a nomadic culture, which later fell to Soviet control. It became an independent communist state and recently gained its independence and became a democracy in 1990. So neonatal mortality in Mongolia remains high at about 11.1 deaths per 1,000 live births, which is about double that of the surrounding areas. The leading cause of infant mortality in Mongolia is sepsis, and the majority of those cases are due to group B strep. So group B strep, or GBS, is a bacteria. There's different serotypes responsible for causing disease. It can be passed from mom to infant during childbirth and lead to GBS disease in neonates. The main takeaway is that transmission from mom to infant is preventable either through antibiotics or potentially vaccination. So a little bit more about the natural history of GBS. So about 1 in 4 women are asymptomatic carriers of GBS, and about half of them pass it on to their infants during childbirth. Up to 1 to 2% of colonized infants go on to develop GBS disease in their first few days of life. GBS disease can present as respiratory distress, as sepsis, as pneumonia, or meningitis, usually in the first day of life. About 2 to 8% of infants who contract GBS disease end up dying, and those who survive, most of them go on to have permanent disabilities. So in the U.S., all pregnant women are cultured for GBS, and positive women receive antibiotics during labor. However, this isn't really a practical solution in many low and middle income countries due to limited resources. And we think that vaccination may be more effective in these populations. And the reason the project is especially important right now is that there's a new GBS vaccine in clinical trials that could potentially protect mothers and infants against this disease. So the aims of my project were to first quantify how many infants have GBS disease in Mongolia, to determine which serotypes of the disease are present in Mongolia, which comes into play later when we talk about vaccinations. And we were doing this by estimating the prevalence of GBS colonization in pregnant women, and then estimating that about 1 to 2% of those colonized women would give birth to kids with GBS. So the way that our project is being carried out is that pregnant women in their 3rd trimester of pregnancy are swabbed for GBS, and our colleagues in Mongolia culture this in their laboratory, and culture positive GBS strains are further serotyped. And we plan to enroll about 300 women during this time, and that should take about 6 months. So once we have the prevalence, we're going to use that to estimate how many infants may have GBS in Mongolia, and also to determine if the current vaccination that's in clinical trials could be effective here. So yeah, as I said, the main important takeaway from our project is determining whether vaccination is an effective intervention. So a little bit more about what I accomplished during my trip. So I went to Mongolia for 4 weeks this summer, and I was in the capital city of Ulaanbaatar. I was working with Dr. Jargal Saikhan, who is an obstetrician in one of our study sites. The main purpose of my time in Mongolia was to initially set up this study, which was setting up the laboratory and training our colleagues who are actually culturing in the lab. So a lot of my pre-trip preparations involved figuring out how to get the supplies, like the laboratory supplies we needed from the US to Mongolia, and also to develop educational material such as pamphlets and PowerPoints to teach our colleagues how to carry out the project. So this is a picture of our study sites. Our laboratory was located in the First Maternity Hospital, and we also had we were also enrolling women at the National Center for Maternal Child Health, which has a long-standing relationship with CHLA. So one of the challenges going into Mongolia to set up this project was figuring out how to get the supplies as well as the laboratory equipment that we needed to the site. And as you can see, this was a one-room lab. It was the only microbiome lab in 4 of the maternity hospitals there. So it was kind of a challenge at first, but to our excitement, it had all the equipment we needed. It had our fridge, incubator, and culture hood, so we were able to successfully set up our lab space. I also had a chance to go outside of the city and visit some rural health clinics. So first we traveled south to the province of Ulaanbaatar, and what you see over here is the hospital that's serving this province. We also got to visit the public health department, which is on your bottom right corner. I also had the opportunity to travel to the very north of Mongolia and visit another clinic there. So this is the primary clinic that serves a population of about 130,000 in that north province, and the yellow building at the top is the public health department there. I was lucky to be there during the Summer Festival of Nadam, which is 3 days of horse racing, archery, and wrestling. I got to try on the traditional outfit, the Dell, and walk in. They had this best dressed foreigners competition. And I also tried one of their delicacies, which is arag, and that is fermented mare's milk, and it's an acquired taste. Yeah, so I'm really grateful for the Anderson grant that I received to allow me to take part in this project. This was my first time working on an international or global health project, as well as taking responsibility for starting up a project from writing the IRB and the proposal to setting it up and to seeing it to completion. So there was a lot of learning points. Some things I learned about working in global health. I guess some challenges were working across a language barrier. Luckily, the doctor I was working with was able to translate, but it's still somewhat of a challenge. Also, working in a setting where resources are limited and making the most of the equipment and the space you have, and also kind of learning how to navigate a foreign healthcare system where some things such as like their IRB, like they only hold IRB meetings twice a year, so it's like, you know, protocols are different and navigating that. But I'm so thankful again to the Anderson grant, which I learned about through an email from my PI. So I think it was about talking about money, like $3,000 grant, and I would say my plane ticket round trip was about $1,600, and then I stayed in a student dorm, which was $20 a night. So and we used rest of the money on supplies. So that was an incredible experience.
Any questions? Oh, that's a question.
So for implementation, because we're right now down in analysis, will you be heavily involved in that?
Yeah, so this is kind of more just communicating and following up with our colleagues there. So they're actually collecting the data and recording it into this online portal, which I'm able to see. So it's kind of more like following up, seeing how things are going, but it's definitely like a lot less involvement than it was setting it up or when we'll be writing up the paper.
There's a question over here.
Yeah. Is this camp for your RSP?
Yes, yeah. So I use this for like med students. We have a required scholarly project. So yeah, I'm using this for that. I think I kind of, to be honest, I wasn't necessarily looking for a global health project. I just kind of like fell into it. I was interested in the work my PI was doing with microbiome and vaccination, and she just happened to have a project that was starting up abroad. So that's how I got involved with that. Yeah.
Could you also kind of talk about the timeline of like, you know, you're initiating connection with your PI at CHLA and then coming up with the project, applying for IRB and everything?
Yeah, for sure. So I met my PI in January when we had a research mixer at CHLA. So I followed up with her in January. I met with her then. She started telling me about this project and gave me some more information to read up about Group B strep. So once I was sure that I wanted to do it, I began writing up a project proposal. We kind of based it on a similar study that was done in India. So I had that as, you know, a takeoff point. And I would say that proposal is the same proposal I could use for the grant as well as for IRB. So I think I applied for the grant in maybe February or April. I applied for the IRB in April as well. Then once school ended so beginning of June is when I started working on like gathering the material and setting up the training materials, and went on the trip from end of June to end of July.
So yeah, so the Bremen scholarship is also available to medical students as well. So if you're a medical student, you can apply. Other questions? I I think that generally just in terms of financing, so the Geneva trip, you have to buy an airline ticket and your housing. That's the cost associated with that. So it's probably, I don't know, $2,500 maybe.
For the entire trip?
For the 2 weeks. I'm not doing the whole immersion, but it's maybe like, I'm guessing it's like $2,500 for the trip. Plus tuition. For Uganda, we had an $1,800 program fee plus the ticket, which is usually about $1,800 as well. So it comes in at around $3,500 maybe to be like at the far end of that. And then Panama, they've had a really great deal where you just pay the plane ticket and they've covered you when you're there, plus tuition. So there's kind of a range as well, like financially. And then now we have the Bremen scholarships, and hopefully also the Anderson will be continuing this year, so we'll have those available to students. And the Mongolia relationship also extends to public health. So Melissa Withers has been also working extensively in Mongolia, with colleagues at CHLA. Other opportunities, and we had a student go to Vietnam. She's still there. I think she comes back any day. We also have a lot of contacts in Mozambique. We've had a recent alum there for the last few months, and we're hoping somebody, wink wink, will go to Mozambique for an extended period of time, and then hopefully also taking a group to Mozambique, probably as an immersion experience, not an official course, and more of a like first time as a group trying it out with our colleagues there. So there will be more opportunities popping up, but these are kind of our standard ones that we've got right now. All right, thanks. All right, thanks everybody. If you have any questions, I'm happy to hang out here for a little while. Otherwise, get on the listserv for the Institute and the MPH, and hopefully we'll be sure that you keep in touch.